Hi guys, welcome back to my channel. In this video today I will discuss the continuation of NHS interview series. So I will tell you guys about clinical governance in detail. So clinical governance has various definitions. One of the most important one which we usually use is a framework through which NHS organizations are accountable for continuously improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish. There are various other definitions as well. Some of the people are saying that it is a quality assuring process designed to ensure that standards of care are maintained and improved, and NHS is accountable to the public. And in simple terminologies, we can say that it's an umbrella term that encompasses a range of activities in which clinicians should become involved in order to maintain and improve the quality of the care they provide to the patients and to ensure full accountability of the system to the patients. Clinical governance, basically it consists of 7 pillars which can be memorized by the mnemonic PIRATES. P stand for patient and public involvement, I stand for information and technology, R stand for risk management, A is for audit, T is for training, E is for effectiveness, and S is for staff management. Out of these 7 pillars, we should memorize at least 4 by heart, 4 very important pillars which are memorized by the mnemonic CARE. C stands for clinical effectiveness, A is for audit, R is for risk management, and E is for educational training. So these 4 pillars we should tell to the interviewer in detail as well how we implement these in our daily life, and the rest of the 3 we can just mention their name. So I will tell you guys how to provide a little detail of these first 4 pillars. About clinical effectiveness, it includes the management of the patient, how we approach our patient, whether we are adopting an evidence-based approach, and are we willing to learn new protocols and guidelines based on the experience and evidence, and are we implementing the NICE guideline and local hospital guidelines at our trusts. And it also includes research, so are we willing to conduct research to develop the evidence, the body of evidence available, and to enhance the level of care provided to the patients in future. This is the first and foremost. Second one is audit. The aim of audit process is to ensure that clinical practice is continuously monitored and that deficiencies in relation to the set standards of care are remedied. In this, you can explain to the interviewer about any recent audit that you have done and what purpose you have achieved after doing this audit. Third one is risk management. Risk management involved having robust system in place to understand, monitor, and minimize the risks to the patient and staff, and to learn from mistakes and near misses. When things go wrong in the delivery of care, doctors and other clinical staff should feel safe admitting it, and we should be able to learn and share what we have learned. It includes complying with the protocols like infection control techniques like hand washing, discarding shops, and identifying patient by 2 identifiers, learning from our mistakes, reporting the significant event by DATEX forms, and assessing the risk identified by likelihood of recurrence and severity of impact if an incident happened, and promoting a blame-free culture to encourage everyone to report problems and mistakes. Next thing is education and training. 50% of medical knowledge changes every 5 years. So education and training is very essential part for clinicians to be up to date. Education and training, we should continue lifelong learning. In practice, for doctors it involves attending regular courses and conferencing. That's why we have this CPD thing in our appraisals annually, and to do relevant exams which are relevant to our specialities like SC exams or MRCP exam and ALS training that also include education and training purpose, and regular appraisals which ensure that all the mandatory things are fulfilled on time. So fourth point is patient and public involvement. Patient and public involvement we can do by taking regular feedback from our patients, and PALS is also a form of this, in which patient can raise their concerns and they can be resolved later on. And there are national patient survey organized by Healthcare Commission, and there is local involvement network. So we should take some formal and informal feedback to improve our services to the patients. Fifth point is using information and technology. It is that aspect of clinical governance which ensures that patient data is accurate and up to date. Confidentiality of patient data is respected, and data is increasingly used to measure the quality of outcomes and to develop services tailored to local needs in the form of doing audits and quality improvement projects. Next one is staffing and staff management. It includes appropriate recruitment and management of the staff, ensuring that underperformance is identified and addressed, and encouraging staff retention by motivating and developing staff and providing good working conditions. So this is all about clinical governance. As I mentioned previously, the first 4 pillars, which are memorized by the terminology of care, they should be on our fingertips, and we should explain in detail about how we are implementing these 4 pillars in our daily routine. Okay. Thank you so much. That's it.